Have you ever been dizzy enough to the point that you lost consciousness and fainted? There is something called vasovagal syncope or neurocardiogenic syncope, where the patient feels lightheaded and enough to the point that they lose consciousness. So there is a specialized nervous system called the autonomic nervous system, and a part of it is the vagus nerve. This nervous system supplies the heart and the blood vessels. So when we change position, or if the body is under stress, this nervous system kicks in, so causes vasoconstriction of the blood vessels and increases the heart rate, and therefore blood pushes to the brain, as the brain is the most vital organ that requires continuous blood supply. See, in those patients, this system fails. It fails sometimes for no reason, because they're born that way and it's not sensitive enough to function well, or because of other issues in the body or other diseases in the body, especially autoimmune diseases or diabetes, for instance. And therefore, this system does not kick enough and the patient faints. So the symptoms, usually the patient feels lightheaded to the point that they're gonna faint, associated with palpitations, chest pain, and at times sweating, nausea, vomiting, even to the point that they lose consciousness. They lose consciousness for a few minutes and then they regain consciousness, they go back to normal. They're not confused, they're 100% normal after they regain consciousness. So typically this is a cardiac issue, so the patient should be seen by a cardiologist. The cardiologist will order an EKG, an echocardiogram, might order a stress test and a Holter monitor, where they give him a device to wear at home to document the fluctuation in heart rate during those episodes. Triggers for those episodes, usually a heated environment, especially if you are in a hot shower, steamy shower with the doors are closed, or if you are in a hot environment. Sometimes stress or anger, sometimes too much happiness, even to the point that a cough or a sneeze can trigger those episodes. So the good news about it, this is benign and it's harmless. So after we confirm it and we confirm the diagnosis, we educate the patient. We educate him to avoid any steamy showers. If you want to take a shower, keep the window open. Use colder water if possible. If you have a hot day, try to avoid the sun. And try to increase the fluid intake as much as possible. Try to avoid being stressed. And if you feel dizzy and lightheaded to the point that you're going to pass out, try to sit down or lay down to avoid passing out. But at the end, it's benign and it's harmless, as long as you don't injure yourself when you lose consciousness and fall. Rarely we might use some medication that help with those symptoms. So just be aware of this type of loss of consciousness. Is common. It can affect younger individuals and older individuals. Get diagnosed and treated appropriately, and you can live a normal life with it. Thank you.